Good morning, everyone. The Public Health Training Center wanted to show a video to get everything kicked off. So here we go.
There are 7 billion people on this mud ball. With that many people buzzing around, we're bound to collide. Where I'm perfect. Did I wash my hands this morning? What did I eat today? Does my child need a vaccine? I don't remember what I did last night. In all the beauty and brilliance of humankind, collectively, we're a petri dish. 40% of people don't wash their hands after they use the bathroom. So how many door handles and elevator buttons did you touch today? We're ubiquitous and busy. We're impulsive and experimental. And in our most intimate moments, regard for safety isn't, well, always of interest. Where we live, the air we breathe, our habits, the things we do every day have more impact on our health than genetics. And that's why there are public health professionals in the midst considering our well-being when we're not. These heroes go to the places others won't. They're on the front lines developing new programs and policies. They conduct and disseminate research on vital public health initiatives to keep us alive. They strive to make our communities equitable, healthy, and resilient here and abroad. They work with us, not against us. Pondering the public health of 7 billion people is no easy task, but it's happening right here, right now, at the University of Nevada, Reno, where students studying public health don't just learn, they implement and save lives. Today, we're recruiting the courageous. Join our team of heroes working for the greater good.
Right. So thank you to Renown Health for sponsoring this little series of echoes.
Good morning, everyone. Thank you for attending this public health echo about leverage the law to improve health. My name is Allison Claudianos. I'm the program coordinator for the Northern Nevada Alliance for Health and Justice.
And I'm Rita Greggio. I'm the attorney at the Northern Nevada Alliance for Health and Justice.
Before we get started today, I'd just like to take a moment to thank some of our partners in this project. First, Washoe Legal Services, Northern Nevada Hopes, the Nevada Public Health Training Center, and the UNR School of Medicine.
And Renown, of course, for sponsoring this series of public health echoes.
Definitely. So today we're going to cover the medical legal partnership model. What is the program? Then we're going to talk shortly about the Northern Nevada Alliance for Health and Justice. That's the local medical legal partnership program between Washoe Legal Services and Northern Nevada Hopes. And then we'll cover common problems in landlord-tenant laws. So I think the best way to talk about medical legal partnerships is to give you a little bit of information about where they all began. So in the early 1990s, a hospital in Boston noticed that there was a lot of children were visiting the hospital for symptoms of asthma, and they would continue to come to the hospital. The doctors would treat the symptoms of asthma, and then the children would go back home, and they would continue to be sick. And the doctors realized that, treating the symptoms of asthma over and over again was not going to fix the problem. What was actually happening is in the homes where these children lived, they lived in sick housing. There was exposure to mold and other contaminants in the home that were outside of the scope of work for a doctor to take care of. And that's when they asked attorneys to come in and hold the landlords accountable for maintaining the housing up to codes and standards for health and safety. So that's where it all began. This is an overview of generally what a model of a medical legal partnership looks like. So it's a partnership between a medical entity and a legal entity. In our case, our program is a partnership between Northern Nevada Hopes and Washoe Legal Services. Northern Nevada Hopes is a federally qualified health center. They are HRSA funded. And our partner, Washoe Legal Services, is a legal aid agency that provides vulnerable populations access to justice, regardless of their ability to pay, to protect their rights, safety, and family stability. So the thing that's very interesting about our program is we are fully embedded, which means that our attorney from Washoe Legal Services is available at Northern Nevada Hopes every single day, fully embedded. meaning that the clients from Northern Nevada Hopes don't have to go to another agency, establish a new relationship with a new agency in order to get the help that they need for stability in their lives to improve their health. There are many different structures for medical legal partnerships, but the National Center for Medical Legal Partnerships recommends this model in order to reduce barriers as much as possible. So we're working towards full integration. One of the things that our program does is we look at the social determinants of health. So what are the things that are happening outside of a medical visit that can help improve stability in a patient's life in order for them to improve their health outcomes? So the WHO's definition of social determinants of health are the conditions in which people are born, grow, work, live, and age. These circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. The social determinants of health are more responsible for health inequalities than the unfair and avoidable differences in health status seen within and between countries. So our program is one of the many contributors to the social determinants of health, looking at what are the differences between, providing resources in an area of health so that clients can have further stability in order to focus on their health outcomes. Our program is a three-pronged approach. We provide legal services, referrals to legal services, either internally in our program or externally in the community. We also do legal consultation, Rita does legal consultation. And then we also provide legal education clinics where we increase knowledge and, confidence, thank you. Knowledge and confidence upon accessing legal resources. So the types of legal services that we offer, civil legal aid generally provides these legal services here. Consumer protection, family law, immigration, income maintenance, landlord-tenant, record sealing, both for criminal record sealing and eviction record sealing. And then finally, wills, living wills, guardianship, and power of attorney. These services are under the general umbrella for civil legal aid. And these are some ways that providing these services to clients of HOPES can improve health outcomes in the long term. So improved ability to prioritize health and health care, improved continuity of care, obtained insurance coverage of care and treatment prescriptions, increased access to healthy built environment, mitigation of risk of homelessness, improved habitability of living conditions, and improved ability to prioritize health and health care. So these are some data from our program. In 2018, internally at Northern Nevada Hopes, we received 306 referrals. To kind of put that into context for you, in the year 2018, there were 261 working days, which means that we received a little over one referral for every single working day of the year in 2018. During that time, we closed 148 cases. So we had 148 encounters where people actually came in and spoke with Rita about their personal civil legal issues. Briefly, here's a little diagram of some of the legal services or the level of legal services that clients received during interacting with the Northern Nevada Alliance for Health and Justice. As you can see, the majority of our level of legal services is counsel and advice at 55%, but there's
If I could just jump in, and just to clarify what counsel and advice means, basically it's a consultation where we're not representing them, but we may be advising them what to do and answering legal questions for them.
Would you like to explain the other areas? Legal representation before court or agency, and then negotiated settlement without litigation. So there's a very large variety of the depth of legal services provided, and that's just dependent on what the issue is and whether or not Rita will explain those things
Right.
later.
There are categories that we track our numbers by, and basically something like negotiated settlement without litigation might mean that we wrote a demand letter, or we worked with a landlord to get them to repair the premises without having to go to court. Legal representation before a court or agency could be something like an eviction hearing. It could be something like an SSI, Social Security denial hearing. So it could be before a court or an agency like Social Security. And then limited services or extensive services are usually things where maybe we're doing a lot of research for the client, or something like that, something where we didn't actually negotiate a settlement and we didn't actually end up going to court for them, but we helped them out in some way. And it's times when we do something a little more than just doing a consultation and giving them advice on the spot. And then one last category that Allison can just briefly cover with you is the referrals/non-response, if you want.
Okay, so the referral/non-response is when we receive referrals internally at Northern Nevada Hopes. Sometimes maybe the referral is outside of the scope of work of our program. Sometimes we receive referrals for criminal issues, which is not an area that we cover in our program. I'll refer them to the appropriate place. And a lot of let's see, and then the other portion of that 16% is a non-response. So I have received a referral internally, I've made contact with the client, and then between the time that they've contacted me and they've had their appointment with Rita, they were lost to follow up. And so here's some data about our legal education clinics in 2018. Last year we had 10 legal education clinics. And we also did one substance abuse continuing legal education training, which is a CLE, continuing legal education. And out of all of those legal education clinics, we had 197 participants. So we had a large reach in 2018, and we're hoping for an even larger reach in 2019. We also do internal trainings. To date, we've had 4 public health interns from the School of Community Health Sciences at UNR. Last summer, we were lucky enough to have 1 law student intern from the William Boyd School of Law at UNLV. And then currently, we have a volunteer who is a paralegal law program student at TMCC.
Okay. So I'm going to talk now about why we chose to highlight the issue of housing and how it relates to health, and specifically how medical professionals can sort of spot issues that could be referred to legal aid to address some of those health harming legal needs of the population. So as Allison mentioned, going back to the very first MLP, it's interesting that the issues they were addressing were habitability issues, right? So poor living conditions that were affecting the health of children, where the healthcare practitioners could address those medical issues, but there was something, something causing those issues that they couldn't get to, right? And that's kind of where the legal part comes in. And we still see these issues today, habitability issues, particularly here in the Reno area where I practice, are, they're a very big part of what our legal aid agency deals with. And then the other example, right, so kind of obvious how poor living conditions can affect your health. If you have a bed bug infestation, mouse infestation, obviously it could have effects on your health, but things like evictions, right, can also affect your health. So in the eviction setting, a lot of times tenants might not know that they have a defense, so they might not bother going to court. And if you don't go to court, you lose by default. Obviously, then you have an eviction record, which makes it that more difficult to secure future housing, because landlords are going to discriminate against the fact that you were previously evicted. It might also create a bar to for the very low-income individuals for future public housing assistance. So, and then finally, housing stability can have a real snowball effect, right? So I'm losing my housing, so therefore I can't go to work, I become homeless, you know, it all feeds into the cycle of poverty, my kids miss school, and all of those things can affect not only your physical health, but, you know, can have a huge impact on your mental health. So, you know, the reason, again, we're highlighting housing and health is because there are a lot of issues in housing that might not be readily apparent to someone who's not a legal provider, and that they might actually come up in the course of someone's healthcare. So I'm going to talk, when I do talk about the issue spotting, I'm going to talk very generally about issues, because obviously we're a nation of many different states with many different state laws that vary widely. But I'm going to be talking about how you can try to issue spot some of the more common problems. I won't necessarily be talking about, again, specific state laws, but I'm going to be talking about it very broadly. And again, the purpose of this is to make individuals who are not in the legal, you know, I always joke when we do internal seminars at Hopes, you know, I always tell the medical providers, I'm not trying to make you guys mini lawyers. I don't expect you to answer people's legal questions or, you know, give them any kind of advice. But, you know, the idea is to make you guys familiar with the types of issues that legal aid providers can assist clients with, and to make you aware of the places where you might refer those patients having those problems. Thank you. So why does it matter, right? Housing and health. What's the role of medical practitioners? Well, the doctor-patient relationship, obviously, it's a relationship of trust and openness. A patient, at least in my view, is more likely to reveal something to their doctor that they're embarrassed about, that they may not reveal to others, right? So, hey doc, I have these bumps on my arms because I have bed bugs, right? A lot of people would feel hesitant to tell other people about that, but it is something that affects their health. So something that they would share with their medical provider. And again, perhaps, you know, a legal referral can be a part of that treatment, right? So rather than treating someone and sending them right back into the same conditions, causing their condition, realizing that there might be assistance to treat the underlying cause. Of course, to do that, you guys need education and access to those resources. But again, you know, as our MLP shows, medical practitioners can help to reduce the barriers to accessing legal aids. You know, within our own program, obviously it takes time for something to develop, but one of the things we've done at Northern Nevada Hopes is we've done a lot of seminars to teach the providers about, you know, a lot of the common legal issues. And, you know, from the first to the second year that we were at Hopes, our number of referrals, they literally doubled. And I think part of that was, you know, once you have that education, you're able to make that proper referral. One of the examples that I like to use is as an FQHC, Hopes has housing case managers. And in one instance, an individual came to their housing case manager and they said, you know, do you think you could write a note to my landlord, you know, letting them know that my rent's going to be late, but that I'll pay it. And so the housing case manager, you know, just saying, okay, this is what the person needs, writes the letter. The letter does nothing, right? The landlord's like, I don't care. And then the landlord proceeds to try to evict that person, you know, with knowledge about housing issues that those providers, those case managers, now they know, well, maybe this is something that needs to be referred to an attorney, right? Maybe the attorney can help them with this. Because again, you know, sometimes the clients themselves, they think that what they need will help them when it doesn't. So again, you know, the role of the medical providers and of the other providers in an FQHC like Hopes is having that knowledge and that resource, right, to make the appropriate referral. And then again, you know, of course, as the medical providers, you guys are dealing with the consequences of individuals' poor living conditions, right? You're treating the asthma that's caused by mold. You're, dealing with the illnesses caused by, a roach or a pest infestation, the stress and anxiety caused by their living conditions. So you guys are on the front lines and often the first to know about these issues happening in patients' lives. Okay. Okay, so housing and legal aid, how do we, legal aid, address housing issues? And why do we address housing issues? So a lot of our client population is indigent or low-income individuals that can't afford private attorneys, right? So if you're being evicted for non-payment of rent, you're absolutely not gonna have money to go hire a lawyer. That's one of the reasons that many legal aid organizations across the country provide free legal assistance to low-income renters facing eviction, because that's just an area of law where people absolutely can't afford private attorneys, and there is a disparity in the power relationship between a landlord and a tenant. This was something interesting that I just read recently. There was a study published in the Journal of Sociology this past January that talked about the rate of exploitation of tenants in poor neighborhoods versus more middle-class neighborhoods. And basically this study found something that a lot of people have experienced sort of, like I was talking to one of our housing case managers, and it's this idea that, right, slumlords make more money than landlords in higher income neighborhoods. And so it's this idea that landlords expect that there will be more problems, more repairs, etc. in poorer neighborhoods, so they jack up the prices to compensate for that. But what the study actually found was that the rate of repairs and loss between the lower income neighborhoods and the higher income neighborhoods was not that different. So, by jacking up these prices in the poor neighborhoods, the landlords are actually making a higher profit. So in the study, they looked at exploitation as being overcharged relative to the market value of the property. And that's what they found, right? They found that these properties in poor neighborhoods, they were less well kept, and relative to what they're worth, they were being charged higher rent. So of course, this is something that we know, right? The cost of being poor. So poor individuals often face higher prices, and particularly in housing, even though they're receiving less of a benefit. So the other thing that we like to focus at, in our MLP is prevention and education, right? So a lot of our tenants aren't well informed about their rights and their responsibilities. So if we can empower them through education and we can help them know their rights, we can avoid sort of that snowball effect, right? So they didn't act on an eviction because they didn't know they had the right to do that. So now they've been evicted, now they're homeless. So they're facing all these effects. If we can catch issues early on, if we can empower people with education to know their rights, we can sort of prevent some of these issues from even becoming, right, like a matter that goes to court. Next one, please. And I'll give you an example, going back to the last slide, this idea of disparity, right, of power between landlords and tenants. Obviously, landlords, most of them, it's a business for them. A lot of them can afford lawyers. A lot of them are very well informed about their rights. And I'll give you an example of something that actually happened in my practice. So the tenant got a letter that said something to the effect of, you're in violation of the lease. If you don't fix this issue, we're going to evict you. Well, the tenant sees the word eviction and they absolutely freak out. They don't know their rights. So they go to the landlord and they're like, oh, I don't want you to evict me, so I'm going to move out. Well, they break their lease and they don't know that if they break their lease, they're liable for the amount of rent until the end of the lease period, and then the landlord goes after them for the unpaid rent and all of this. And all of that could have been avoided, right? If the client had met with an attorney, had said, hey, my landlord is talking about evicting me, if they know that there are ways to fight the eviction, that there are alternatives to simply breaking the contract and then being liable for this amount of money, that could have been prevented. So again, we do try to stress education for our client population, because I do think it's a powerful tool in sort of even preventing some of these issues. So one more slide to talk about, again, why I think housing is such a great issue to talk about in this presentation. In 2017, the Nevada State Bar and the Nevada Supreme Court Access to Justice Commission, they commissioned a study, and some of the significant findings of this study, so this was a study about the justice gap in Nevada, right? So access to justice, access to legal help, access to attorneys. And some of their more significant findings were that in Nevada, there's a definite unmet legal need, particularly for households at or below 125% of the federal poverty line. They found that in this distinct population, in Nevada households, there were 147,000 legal problems per year that they faced. So this is generally, legal problems generally, housing, family law, many types of legal problems. And then they found that only about 35,000 of those problems were being addressed per year with the help of legal aid. Is there a question? Yeah. Okay. So let's see.
Can you provide any answers for more of a warm handle to advice and navigating connecting to legal aid?
Okay.
We can talk about that.
Yeah, so we will talk, Emily Brown asked a question, and so talking about how to provide support and, a term we often use, right, the warm handoff, and we'll talk a little bit about that at the end. Obviously, we have a way we do it because we do have an MLP, like Allison said. I am embedded in Northern Nevada Hopes, but we can talk about some resources and strategies at the end. So great question. And so the unmet legal needs. And so the gap that they found between, obviously the 147,000 legal problems versus the 35,000 that were being addressed. So the gap that they found was that these households at 125% of the federal poverty level had 112,000 legal problems per year for which they did not get help. Which meant that 76% of the total legal needs of this population went unmet. Now, in the study, they talked to stakeholders, meaning legal aid agencies across the state, and housing and affordability was named the #1 unmet need in all of Nevada. So, again, housing is so critical to people's health, and there is often so many issues surrounding housing, and people just aren't getting the help they need, that if we have more interventions, more people learning about legal aid and having access to those resources, the more we can do. And I should point out that just yesterday I was reading that currently Washoe County, and this came as like a total shock to me, ranked 6th in the country for unaffordability of house buying in the house buying market. So our housing market, our rental market has really, prices have skyrocketed in the last few years, and it's definitely causing a lot of the lower income people to feel the pinch. Especially the senior population, individuals on fixed incomes, it's been a big issue. And again, as you can tell, even back in 2017, the #1 issue identified as the unmet legal need in Nevada was issues relating to housing and affordability.
We did have a question. When you help with housing, do you also include utility payments, energy, water, sewage accounts?
Yeah, so that's a really good question. It's gonna depend on, it's gonna depend on the specific state statutes, but those are typically the types of issues that we can help individuals with. For example, some landlords might include utilities in the price of the rental, but they may be charging, a tenant a higher amount than they're actually being billed. So that might be a type of issue that we might be able to look at. Obviously, things like my electricity is being shut off by my landlord, definitely something that we can do something about, and some of the issues that I'm going to talk about in the next slide. So pretty much housing, it's a pretty broad umbrella. So I'm going to talk about specifically some of those issues and how do issues spot for medical professionals. Some of the statutes that I'm going to be referencing are by the ULC. The ULC is called the Uniform Law Commission, and what they are, they're a group of lawyers who get together to draft what's called model legislation. So this model legislation can be adopted by states, and many states will often adopt all or part of the uniform laws. So some of the things I'm going to reference are going to be from the Uniform Residential Landlord and Tenant Act, so which is state law. So let me back up a little by saying that when we talk about housing issues, we're in America, so we have the state law system and the federal system, and there's an interesting interplay between them. So there are issues that will be addressed at the state level, and then there are issues that will be addressed at the federal level, namely the Fair Housing Act. So the Fair Housing Act is going to address things like discrimination in housing. The Fair Housing Act makes it unlawful to refuse to sell, rent to, or negotiate with any person because of the color of their skin, because of their disability, their familial status. Familial status is one that's kind of tricky for people. It basically means you can't say, no, I'm not renting to you because you have kids and I don't like kids. National origin, race, religion, and sex. So when people do face discrimination, and it could be discrimination in getting a mortgage loan, right? It could be discrimination in that someone won't rent to you because you're in one of those protected categories. It covers a lot of aspects of housing. That you would be looking at the Fair Housing Act. Something that attorneys can help with, right? We can look at, is this landlord turning away all African Americans, with the same income as, white Americans? So those are things that we can look at and potentially help someone with, right? And discrimination can be tricky because a lot of times people think they're being discriminated against, and it's kind of a moving target. But again, if someone suspects or if they have reason to think that they're being discriminated against, it's perfectly appropriate to refer them to an attorney to evaluate that. And then the other issues that we see a lot with federal law, with the Fair Housing Act, are reasonable accommodation issues, right? So my landlord is refusing to let me have a service animal or an emotional support animal, or my landlord is charging me a pet fee, even though, the Fair Housing Act says that if it's a service animal or an emotional support animal, it's not a pet and you can't charge a pet fee. So those are the types of issues that we see. We can also help, a tenant who's been denied a reasonable accommodation. We can negotiate with the landlord, and then if necessary, take it to the point where you're suing someone over that, right? And
sorry, would you like to look at the implications? Can you work with energy firms or research firms that have proposals on utility residential constructions, or can the consumer go to learn about what are the fair prices of utilities? That's an interesting question.
So the question is about where can the consumer go to learn about what are the fair prices of rent and utilities? That's tricky. I'm going to address the rent issue for a second. every state has different laws regarding what a landlord can charge for rent. Some individuals who are from New York might be familiar with the term rent control, right? So it kind of a limit on how much landlords can increase your rent. In states like Nevada, unfortunately, there is no rent control, meaning that as long as the landlord is giving the proper notice set out in the statute, they can raise the rent to whatever they like. They can raise the rent beyond fair market value. As long as someone's willing to pay for it, you know, it's their right to do that. Utilities, I'm not an expert on utility law. It can get very complex, so I'm not going to address the utility issue. But certainly, again, you know, the issues that we've seen are when the landlord is the one billing the tenant for the utilities, and they're billing the tenant at a higher rate than their actual use, right? Then we might have an argument to say, well, you know, that's fraudulent. You shouldn't be doing that unless, you know, there's a specific agreement for that. I think we have a question now about support animals.
Yeah, what would happen in the event that a person lies about having a pet, claiming that the pet is an emotional support animal?
So that's a very good question. It happens a lot. Under the Fair Housing Act, a landlord is entitled to ask for verification. They're limited in what they can ask. So the two questions they can ask is, so obviously the Fair Housing Act, the first, for someone to have a service or an emotional support animal, the first requirement is that they have a disability, okay? And then the second requirement is that the service animal or emotional support animal relieves some of the symptoms of that disability. So with that in mind, landlords are entitled to ask only if it's not apparent, right? If I'm in a wheelchair, my landlord can't say, what's your disability? But if it's not apparent, the landlord can ask what the disability is and how the animal relieves some of the symptoms of that disability. They are entitled to ask for verification of that, meaning a doctor's note. Now, of course, people do lie about it. You know, most landlords are afraid of being sued and afraid of litigation. And a lot of them actually do know that that's all that they can ask. So I haven't seen a lot of issues where, you know, it's the tenant getting in trouble for lying about that. You know, again, they have to meet that burden where they do have to show they have a disability, and they do have to show that the animal relieves some of the symptoms of that disability. So however they're getting that note, you know, even at Northern Nevada Hopes, different medical providers have different policies on whether or not they'll write notes. So again, you know, it is possible that someone would lie about that, but again, most landlords are kind of going to take it at face value because they don't want to risk being sued, right? So that's a little bit about like the federal law and some of the issues that you're likely to see as a medical practitioner, you know, individuals asking for those doctor notes for their reasonable accommodation for their service or emotional support animals. So on the state law side, I'm going to talk a little bit, I'm going to talk a little bit about the some of the issues on the state law side. So, you know, going back to what I was talking about, right, habitability or poor living conditions, I wanted to give you guys a sample, and the sample I'm going to read is from our statutes here in Nevada, right? And again, a lot of states have similar habitability statutes. They may differ slightly, but the crux of it, you'll kind of get a sense of it from the Nevada one. So this is what the Nevada statute says, that a landlord must maintain a habitable dwelling unit, meaning that a unit is capable of allowing an average person to use and enjoy the dwelling and live free of defects affecting health or safety. So the things that are specifically listed in the Nevada statute that comprise habitability, right? It states the following: a unit is not habitable if it violates health codes or substantially lacks hot and cold running water, roof, I know, right? Some of these are obvious. Floors, walls that do not leak, a working toilet, doors and windows that open and close properly, electrical outlets and wiring that operate safely, a unit that's free of garbage, rodents, insects, and vermin, adequate heat, and other facilities and appliances that are maintained in good repair if they're supplied by the landlord. So what that means is, you know, if my unit comes with a window air conditioning unit and it breaks down, the landlord has to fix that for me because he or she supplied it. So again, the Nevada statute is it's a pretty standard habitability statute. Of course, a lot of landlords try to claim that they're not responsible for fixing these things, but at least under Nevada law and under a lot of states that kind of follow the Uniform Residential Landlord and Tenant Act, yes, they are responsible for these things. Now, in Nevada law, of course, there's an exception. It says that if a tenant causes the problem, either purposefully or through neglect, then, you know, they can be liable for fixing it. So if I punch a hole in my wall, yeah, my landlord can't charge me to fix that. But, you know, if this was an interesting case we had, a client lived in a kind of a neighborhood full of crime, and someone shot a bullet through his window. And the landlord refused to fix it because the landlord was claiming that this wasn't some like random criminal activity, but that it was, you know, related to the tenant's, you know, people that the tenant knew. So the legal aid agency in this case was actually able to show that the bullet came from the outside and that, you know, it wasn't anyone related to the tenant, and that, yes, it was the landlord's duty to fix that window and not the tenant's. So the next thing I'm going to talk about is essential services. Essential services can fall under habitability. They're just the more critical things. So like heating in the winter, you know, running water, some of those things, landlords have especially here in Nevada, they have a tighter time frame to fix those things. So in Nevada, if it's a habitability issue, let's say, you know, my fridge broke down, they have 14 days to fix it. If it's considered an essential service, right? Heat, running water, they're going to have only 48 hours to fix that. With regards to evictions, again, most states don't allow self-help evictions. What does that mean? That means that a landlord isn't allowed to just go and change the locks on your door and kick you out without some kind of legal process, right? So that's something else where medical practitioners can be aware that, you know, if someone says, oh yeah, my landlord just changed the locks on me and now I'm homeless, that might be something that a legal aid agency might be able to help someone with. There's only a minority, maybe 2 or 3 states in the US that does allow some type of self-help eviction, but most states will require a landlord to go through the legal system and actually lawfully evict a tenant. So another big thing is landlord retaliation. And again, most states do prohibit landlords from retaliating against tenants for actions they may take, like reaching out to a lawyer about their issues. And so here I'm going to read from that Uniform Residential Landlord and Tenant Act for you guys to get a sense of what some of these statutes say. And so in the URLT, it states that retaliatory conduct by a landlord is prohibited. And it basically says, a landlord may not retaliate by increasing rent or decreasing services, or by bringing or threatening to bring an action for possession, meaning an eviction, after, 1, the tenant has complained to a governmental agency, right? So I complained to code enforcement that my electrical doesn't work. You can try to evict me for that or raise my rent as retaliation, right? 2, the tenant has complained to the landlord for a violation, right? So if I complain to my landlord that my toilet's broken, they can't try to evict me for that. And then 3, the tenant has organized or become a member of a tenants union or similar organization. So again, this is the uniform law, and it's going to vary by state, but generally most states will have some kind of law prohibiting landlord retaliation. And again, the reason these laws exist is because landlords do this, right? They get upset and they try to kick people out or raise their rent as a way to, to get back at the tenant.
One more question from Caitlin Shaw. What is the exact statute for habitability, and how do I find the document, and can it be used in legal cases?
I can't really answer that question because I don't know what state you're in. And if you go online and you search for the habitability statutes that apply in your state, again, every state is different. In Nevada. So I'll tell you what I was reading from. It's NRS 118A.290 subsection 1. So that's what I was reading from in Nevada, the habitability statute, where it states what the landlord is responsible for providing. Now, habitability issues happen a lot because, again, landlords don't want to spend the money to repair things. And if you're in Nevada, we can point you to some resources. Specifically, if you go to Nevada self-help and you type in housing, Nevada self-help, if you Google that, you're going to come up with a lot of resources. The Legal Aid Center of Southern Nevada has really good materials on rights and responsibilities. And then we have some information on our website at Washoe Legal Services as well.
If a landlord tenant do not have a lease or contract, may the rent be raised on a monthly basis to reach a higher rental cost?
So I'm not going to answer specific questions because, again, it's going to be very dependent on what the lease says, what the law says. So I'm not going to go into details about specific issues. Just know that these are issues that if you do have clients who are indigent, who are low income, that legal aid will be able to help them answer. And then finally, I just wanted to give an example of a case where we were able to help one of our clients at Northern Nevada Hopes. And I think it's just a really good example of how our MLP was able to intervene and really help someone. So this case involved a parent who was, she was a single mother, she was HIV positive, and she had two children. One was a preteen and one was a teenager. The preteen child was severely disabled, and the way this case came about to me is that it was referred by the medical provider, right? So this patient told her doctor that she thought she was being harassed by her landlord. And so the medical provider gave a referral to our program, and we had a consultation. And what it turned out was that the landlord was trying to evict her based on something we call a nuisance, right? So the landlord was claiming without any evidence that the teenage child had vandalized some of the bathrooms in the apartment complex. So the client was served with the eviction notice, and we were able to go to court. The eviction came at a very, very bad time. Like I said, she was a single mother. The younger child, who was very severely disabled, had major surgery scheduled out of the state. And so in the middle of all of this, this mom's about to take her kid out of state for this major surgery. She gets this eviction notice, right? So we were able to take it to court, and the judge agreed that the landlord didn't have enough evidence. And so instead of dismissing the case, the client wanted to move out anyway because she did feel harassed, right? She felt like they were trying to do this to her and it was unfair. So since she wanted to move out anyway, and she had assistance from our housing case managers, at Hopes, we negotiated a move out date. So what this allowed her to do was that it allowed her to find new housing without the threat of eviction, right? And so she could take her kid out of state for the surgery and then, be safe in knowing that she's not going to get evicted while that was happening. The case was particularly significant to me because the client was a longtime patient of the clinic, and she also didn't have access to transportation, which is something that Hopes does provide for its patients. So if if Hopes had said, go to this legal aid agency and they'll help you, with your eviction, that would have been a barrier that might have prevented her from getting the legal help she needed. So I just really like telling people about that case because it's just a really good example of why an MLP can be so critical. And again, it's an example of a provider that saw that issue, right, happening and knew to refer the client to legal assistance. And then we were able to get her a really good result. And in the end, it helped the health of the whole family because, had mom and her 2 kids been evicted in the middle of this child's, treatment, obviously it would have had a very negative impact on all of their lives and their health. So it was just a great example of how we prevented a health harming issue, an eviction, through the teamwork of the providers, issue spotting and sending that to legal aid, and us being able to represent her in court and getting a good result. And so we'll continue to take questions if you guys have questions.
Do you create a renter's review list for Washoe County, like Yelp review for emphasizing best renter practices?
We don't have anything like that. Our housing case managers at Northern Nevada Hopes, they're very familiar with different properties. They do work with some landlords to help place some of our individuals. So certainly through the clinic side of it and through the case managers, there is a relationship, right? However, that relationship doesn't prevent them from having us intervene when the landlords aren't, following, when they're abusing someone else's rights, right? The tenant's rights. But yeah, I mean, in being in this line of work and in a town like Reno, Reno's not that big, you get to know who the good landlords and the bad landlords are.
We have one question. It might be a little specific. In regards to the time frame for landlords to fix something, is there a time frame for something like a hole in the roof or ceiling? Does that count in the 14-day?
Yeah, so under the Nevada statute, if you had a hole in your ceiling, that would be considered an essential service, and that would fall under the 48-hour time frame. Essential services are things like, if you don't have a locking front door, they're the really big things that really someone can't be expected to go a long time without having that repaired. And sometimes there are things that, you can make arguments either way. You can make an argument that it's an essential service, or you can make an argument that it's a habitability. Obviously, landlords are always going to try to say, oh, no, that's habitability. We have 14 days to fix it. And again, sometimes it can be a question for the judge to decide.
How can we address this issue at the state level?
So our lawmakers are constantly trying to improve our state statutes, right? And of course, there's lobbying on both sides. Landlords have their lobby, and legal aid agencies like us, we have our lobby. We're constantly trying to see how we can improve the laws to make them more tenant-friendly. In Nevada, they tend to be very landlord-friendly. For example, in Nevada, you only need to give 5 days if someone doesn't pay rent, before you can go to court and get an order locking them out. So it's a very, very quick time frame. It's something we call summary eviction. Some states don't allow it. Some states, it takes months and months to evict someone. But Nevada does have rather landlord-friendly statutes. So, addressing it at the state level, be aware of the issues, talk to your lawmakers, when there is a bill pending. So right now, for example, there is a bill pending where we're trying to move away from that 5-day period for non-payment of rent and giving people 10 days, right? So if they have a 10-day period where they can come up with that money and pay the rent and not be evicted, obviously that helps everybody, right? And not only helps the individual, but it helps our courts because we won't have as many cases, right? Like going to court. So definitely you can find out information about the pending bills and, talk to our lawmakers about voting on those laws that will help tenants.
All right. Any other questions? I think we're good. Okay. Well, thank you so much for joining this Public Health Echo. Here are our contacts if you want to follow up for further questions. And thank you.
Yeah, thank you guys. This was awesome. Wonderful questions. Thank you for attending and spending a little bit of your time this morning with us.
Have a good day.
Thank you.
That was awesome. Good job, Rita.
I talked too much.
No, you
I
did
talk
great.
fast.
I do too.